Poor neuromobility can be something that contributes to thoracic outlet syndrome. For the nerves that run throughout the upper body, they mainly originate in the cervical spine and the upper thoracic spine. Each nerve comes through the segments of the spine, traveling down the neck, throughout the arm, and then down the arm and into the fingers. If, for some reason, there is decreased mobility of these nerves, there can be symptoms of numbness, tingling, or even a feeling of cold or altered sensation in the arm and hands. So one way to improve this sensation is to get these nerves sliding and gliding a little bit better throughout the arms. Okay? Oftentimes we don't think about it, but these nerves aren't static structures. As you reach your arm, as you move your head and reach, some of the nerves can get stretched, some of them can get shortened during this process. What we want to do during these exercises is help slide and glide them, hoping to restore some of the mobility, hopefully improving thoracic outlet syndrome or preventing thoracic outlet syndrome. We're going to go over 3 techniques for the median, radial, and the ulnar nerve. So for the median nerve, it runs pretty much down the front of our arm into our hand. This is the common nerve that is impaired during, if someone has carpal tunnel syndrome from typing, but it can also be impaired in thoracic outlet syndrome. So a test to see if you're tight here, you can just have your arm straight out in front of you, bring your fingers back to the side, and then go ahead and bring your arm out to the side. You can do that on both sides, checking for side-to-side differences, and what you're looking for is any tightness or altered sensation down the arm or even in the neck or shoulder. To help mobilize this nerve, what we can go ahead and do is do that exact same test, so my hand forward, then back to the side, then I bring my arm to the side, and as I go that way, I'm going to side bend my neck, and then return, bringing my head the other way. And just going back and forth nice and easy. And what we're trying to do here, as we're kind of stretching the nerve with our arm coming to the side, if we bring our head towards that side, it should help facilitate some movement that way. Then as the head comes back into the other direction, with my hand returning, it's sliding the nerve back. Once again, that's the median nerve neuromobility. The ulnar nerve is the common nerve that is irritated or you feel when you hit your funny bone. It once again travels down the neck, down the arm, and into the Guyon's canal, where the ulnar nerve then goes into mainly the pinky finger on the front and back side. This is a little goofier one to test, but what you're going to do is just make a circle with your hand, and you're going to bring it up almost like you're making a monocle with your hand. Okay? If this nerve is tight or not moving well, you'll have tightness down the arm and the distribution of that nerve, either throughout the medial side of the arm, near the funny bone or elbow, into the pinky fingers. Okay? If we want to help move and help slide and glide that nerve, we can do similar methods that we just used for the median nerve. You redo that test, and then you're bringing your head towards that side, and then returning. Going back and forth here. Once again with the same principle, helping slide that nerve, and then slide it back. The last nerve that we can test for in this demonstration is the radial nerve. This nerve actually comes a little bit posteriorly towards the infraspinatus, shooting through the tricep, down the back of the arm, into the upper back of the arm here, kind of the wrist extensors, and then to the back of the hand. This is a slightly trickier test to do, but what you can do to test is you just make a fist with your thumb in it, ulnar deviate your wrist or take it towards the outside of your body, internally rotate the shoulder, and then bring the arm up and back. If this nerve is tight, you'll likely feel some sensation in the back of the forearm here where the wrist extensors lie. To help slide and glide, once again, the same principles apply. You do that same test, and then as you bring the arm out, you're bringing that head towards the shoulder, and then as you bring it the other way, the head returns the other way. So overall, there are ways to test for poor neural mobility, which can contribute to either just tightness, altered sensation, or thoracic outlet syndrome. Also, these tests can be used as a sort of treatment or prevention exercise to help get these nerves sliding and gliding throughout the body. Usually how you're sliding and gliding these nerves is by moving apart centrally. In this case, we use the neck. You can also do different motions with the head. We only went over with the hand or the upper arm. We only went through the examples with the head since they're the easiest, but there are different methods to do this as well. This is just one example for improving neural mobility of the median, ulnar, and radial nerve.